Welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you the strides of the National Health Insurance Authority as it pursues its mandate to attain universal health coverage by 2030. In achieving this all-important goal, ICT plays an important role. Towards this end, the eNHIA organized a 3-day stakeholders retreat on eNHIA business process and design of dashboard for real-time analysis. The retreat had Nigcomsat and Integrated Healthcare Strategists and Analytics Limited, who are lead consultants in the delivery of the eNHIA projects. In our stakeholder segment, we bring you interviews with participants of the retreat as they share their views on how it will increase productivity in the authority. All of these and more in this episode of the program. My name is Aisha Muhammad Ahmed, urging you to please stay tuned.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the eNHIA, and top on the line is the sensitization drive on medicine supply for stakeholders in Abuja. These and other news coming up shortly.
The eNHIA recently organized a sensitization exercise in Abuja on the eNHIA Medicine Supply Initiative. The meeting was for Commissioners of Health and CEOs of State Health Insurance Agency. The event was organized to keep stakeholders abreast of the new initiative and to serve as avenue for discussions on its modalities and implementation processes. Speaking at the event, Professor Nasir Sambo said the initiative will improve the integrity of health insurance operations as it will address the challenges of drug supply in the sector.
The whole mark of this initiative is to create confidence in the system and also to use it as a bargaining tool to control the inflation that is not within our own purview. Look at the value of our currency every day coming down and the cost of items going up.
As a background, Dr. Yakubu Agada Amade gave an overview on the initiative.
The rationale for this initiative is mainly to correct the impression that people have of the medicines that are being dispensed under the initiative. And so that's perception. Then availability is also a big issue that we have, where people, enrollees, go to hospital and they are told that they do not have those drugs, and then they have to pay out of pocket.
The stakeholders used the occasion to give goodwill messages and to also pledge their support to the authority. They also shared their thoughts on the outcome of the discussions.
This initiative by the eNHIA is something that is very welcome. As we know, one of the issues we have at service delivery level is that of medicines, qualitative medicines and supplies and commodities. Without that, you cannot have good quality of service. This move by eNHIA to engage manufacturers and ensure that we're getting qualitative drugs supplied at reasonable prices to support the health insurance scheme is very welcome.
It's been very fruitful. The core objectives are largely consistent with the goals and aspirations of the state as well. And these core objectives, I would classify them into three folds. The first is to ensure that we have good quality drugs available. Second is to ensure that there are no stockouts at the facilities. And third is to ensure that we're able to lock down prices, given that we have huge resources to be able to engage the pharmaceuticals.
The Kogi State government has released the sum of 180 million naira for the takeoff of the state health insurance program. The state governor, e-NHIA Bello, disclosed this on Tuesday, the 6th of September 2022, during the flag-off ceremony for the provision of free healthcare services in Kogi State. Governor e-NHIA further assured the people of the state that the program will not die even after he exits office. Also speaking at the launch, the Executive Secretary, Kogi State Health Insurance Agency, Dr. Kunle Aledare, said so far 38,000 people across different local governments of the state have been enrolled for the program. Kunle further said that the program will complement the federal government health initiative and appreciated the governor for prioritizing health care. When fully functional, the initiative, tagged Bello Care, will cater for pregnant women, children under the age of 5, people living with disabilities, as well as persons above the age of 65.
Welcome back. The much anticipated eNHIA is a giant stride that will make access to healthcare stress-free for Nigerians. In this episode, we'll bring you details of a 3-day retreat on the eNHIA business process and designs of dashboards for real-time analysis. Issues around the eNHIA is next. Please stay tuned.
It is a known fact that organizations drive their business processes through ICT. The eNHIA is not left behind because its operations are evolving and there is need for modification in order to accelerate its service delivery. A major move to achieve that is through its eNHIA project that is unique in many ways. On Wednesday, 31st August 2022, the agency organized a 3-day stakeholders retreat on the eNHIA business process and design of dashboard for real-time analysis. The event held in Abuja. It brought participants from the ICT, Programs Department, Contribution Management and Planning Department, as well as the Standards and Quality Assurance Department, including Nigcomsat, an integrated healthcare strategist and analytics limited, who are lead consultants in the project. The objectives of the retreat include deliberate and present business process of eNHIA program department for better understanding of interrelationships and its automation, using knowledge gained to fine-tune and finalize the eNHIA project, to capture all key business processes of all departments, to provide an avenue for Nigcomsat to deepen their understanding of eNHIA processes for the completion and delivery of eNHIA project, and to have a clear understanding of translating management report to dashboards for real-time analysis and insight to eNHIA activities. Speaking at the event, Professor Nasir Sambo, Director General eNHIA, said health insurance involves collection and processing of data that needs to be safe, making it necessary for its various stakeholders to come together to keep it safe.
No matter how much we have been able to develop this ICT infrastructure, if we cannot get information, the right information, and when we need the information, and without analyzing it without timely analysis, the whole investment will amount to nullity. It is important also to appreciate the fact that health insurance is a dynamic, complex industry which involves the participation and coordination of various stakeholders to work towards attainment of universal health coverage. It also involves collection, collation, analysis, and tracking of a huge amount of personnel and health-related data, as well as constant updates with changes in the operational modalities, treatment regimens, and technological advances. Therefore, we need to keep evolving.
The event kicked off with a refresher on departmental business processes, by Dr. Olalekan Olugbenga Olubajo of Integrated Health Strategies and Analytics.
What this does, like I've said, is basically that the business process helps each individual to understand his work better within, and also helps him to understand his role within the organization. So it's not like I'm just doing my job for the sake of doing it, but as an individual, I see myself as contributing to the success of the organization. And that also has the effect of cascading into different workflows. So when all of us understand what we are doing, then it becomes easier because every process is interlinked, and then it all works towards achieving the organization's goal. All right, so why is it important? Now, the business process is the lifeline because it helps to streamline activities and also helps to make sure that you maximize your resources. Now, in this era of where we have cash crunch all over, it becomes important for you to know how you're going to manage resources. By having systems in place, you reduce the expenditures.
Another presentation by Emeka Nze on From Business Processes to Reporting Dashboards. It stresses on reports of activities of the different departments within the eNHIA.
Why do we need dashboards? Provides up-to-date information and context to help inform business decisions. Real-time monitoring of organizational performance from some or all sectors. Performance tracking and measurement. Data transparency and accessibility. Agile business response. Because when you have real-time information, you are most likely to take decisions quicker. You have real-time views about what is happening in different sectors and the status of their tasks and operations. Then forecasting and predictive analytics. Our DG spoke about that. The system is supposed to help us forecast and do predictive analytics about current and future trends as it relates to our operations.
Zainab Mohammed, Assistant Manager, Monitoring and Evaluation Department, eNHIA, gave a presentation on the Basic Healthcare Provision Fund M&E reporting dashboards, which displays updates of the program across the 36 states.
So we started with the development of the basic healthcare provision and dashboard, which we centered on 5 basic operations, namely the accreditation, enrollment, governance, financial management, quality assurance. Now, after the development of the framework, we went ahead to develop indicators also, which is also part of the framework. We developed indicators and also prioritized these indicators. After the prioritization, we developed registers for the facilities. We developed registers that were domiciled at the facility level. We also developed tools for data collection, which we called the officers of the SSHIs, trained them and also trained them on how to domicile these registers in the facilities. They took these tools and registers back to their states, organized training sessions for all members of the facilities, trained facility members, and started collecting the data.
Other presentations at the retreat were automation of eNHIA business process, from departmental job processes to divisions, units, and individual job descriptions, management insights through interactive dashboard, modality for departmental presentations, etc. Different departments took turns to present their business processes, operational processes, linkages to the eNHIA project, and how it interoperates.
Apathy means having a who cares attitude.
Speaking on outcomes, the General Manager ICT at the eNHIA, Mr. Joseph Amakrogowon, said departments should be able to understand the eNHIA project and linkages with other departments.
There is a need for all the departments that are involved in this program, especially the DICT and the programs department. By program department, I mean the formal sector, ISD, that's informal sector, the contribution management, standard and quality department, and of course the planning department, because we are going to talk about data. So to come together and then look at this program holistically, how far we have gone, so that we can now dot the I's and cross the T's to prepare for the launch by the president during the Nigerian Health Insurance Summit. So that is why he brought us together to this place and engaged a consultant that has been part of the dream of eNHIA, or 10-year strategic plan for him, to put us together to define our business processes again. So while we have a look at our business processes, the business processes of each of these departments and how they will plug in to the facilities already already implemented in the eNHIA platform. That's exactly what we have come to do.
Stakeholders at the retreat also shared their thoughts on issues surrounding the automation.
What are we looking at? We will clearly define the business processes. But beyond defining the business processes, we want to work towards automating the processes. Because for health insurance, it must not just be effective and efficient. The cost of services must be affordable. So that way we need to introduce efficiency into various areas. And technology today is used to drive efficiency. Basically, this program is supposed to be a forerunner to automation. Clearly define the processes. We have experts on the other side of digital technology here that will help us to create the solutions. So we are providing that enablement for them and for them to also understand our needs. I think primarily that's what we are doing today, and we are happy to say that we have made a lot of gains as far as these expected outcomes are concerned.
It is obviously a value-added program for the success of the implementation of the eNHIA system development and infrastructure upgrade project. Why? Because all over the world, every project success is dependent on the user satisfaction. This project has been implemented in the last couple of months, and currently it's being refined in terms of the user's experience, and then the new features or some gaps that they have seen. So this is a buying platform as well as a progressive elaboration of the project implementation.
Welcome back from that break. Easy access to healthcare continues with our stakeholders segment. We interviewed participants of the different departments present at the retreat on the eNHIA business process and designs of dashboard, taking note of their views and opinions. Asma Osariki Mohammed of the Planning, Research and Statistics Department said the knowledge gained from this retreat is unquantifiable and will make their job in the planning department easy.
When you talk about the business process, you cannot talk about one department alone because we are all integrated. But what will definitely come out of this thing is where all responsibilities are spelled out. All departments know their responsibilities are streamlined, the linkages involved, and then we are more integrated because, we know who has custody of the data and we know where we are going to access it from. And definitely, at the end of the day, the profits that will come out of this, definitely we cannot really define it, because there's cost containment, more efficiency, better understanding, roles are spelled out. People will definitely be able to go and know what they want to do.
Dr. Sikiru Salaudin, General Manager, Informal Department, said it will improve integration, enrollment and coverage in the programs departments.
It will go a long way in improving, because this will ensure, as you said, interoperability, the integration within the eNHIAs and outside the eNHIAs, which are major stakeholders.
Saidu Adamu said the retreat is timely and will help make the automation easier.
The retreat is a timely one because we're discussing the business processes and harmonization of all the ICT components of the whole authority into one, automating the system and making it easier for operability and also interoperability between the departments and how they conduct their activities.
Femi Adeoye says the eNHIA will speed up processes of health insurance operations.
It will go a long way because it will help us automate all our processes and ensure that we get the best results at every time. It also makes sure that each department is in sync with the other department, such that every department knows what they're supposed to do and there will be no conflicts and everything will work out smoothly. So it's very important. And automating our processes is also very important. It helps us speed up our actions and make sure that we get the best results at all times. And ultimately, it will improve the quality of services that eNHIA has to offer to its beneficiaries. One of the core things that this whole will run on is data. We need data from our providers. We need data for several things to know the disease patterns in the country, to know the kinds of medications our enrollees are receiving, basically encounter data. So on and until we are able to connect with our providers real time, we will not be able to get this data.
Those were the opinions of staff of the eNHIA on how the eNHIA will be a plus to their operations. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: what is the gift ship program?
It is supposed to be all-encompassing program that will cover G, group of people, I, individual, and F, family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed. Provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Here we draw the curtains on this program today. If you have an issue or complaint as an enrollee, contact your HMO or visit the eNHIA office in your state. The eNHIA is structured to address complaints and grievances and meet you at the point of your health needs. Join us again, same time and on this same station for another interesting episode as we continue to bring you more stories of happenings around the eNHIA and health insurance. Enjoy the rest of your day.